what we want. The chameleon, right? This is what we want to see. A bigger study investigating adverse events shows again, CPM technology, no reactions. No immune responses to the product. And again, this is what we see. The chameleon, giving volume, being there, doing what it must do, with no immune reaction. And this is why what we see with the CPM technology makes this product so different. Like excellent safety profile while maintaining its rheological necessities. Why? Limited immune response. Why? Good tissue preservation. This is the essence. So we're looking for something when we're treating the anti-aging, the effects that we need to make the patient more confident in what in essence is surface. Now, going back to what we were discussing before, if we look at this Belotero range, how do we apply it? Right? We're talking about now patients with a volume problem, a volume change, and we want to do that. How do we apply the product? Well, going back to the idea of the volume tissue, there's a volume. Of course, if you look at the portfolio from perspective, we also have a radius. So when would we do what? I already did that hint a little bit. I already hinted towards how do we divide this. Of course, when there's a volume issue, we can grab and go back to our zero range. When there's a lactic issue, yes, whatever it was needed. Dilute, standard dilution, hyperdilution, different versatility in our antibiotics. You could even go to hybrid as a combination of both. Not necessarily. You could double layering or different layers. One layer is Belotero, one layer is Belotero. You can also go hybrid. A combination of both laxity and volume issues. But if you have Belotero, how do you apply it? Well, physiology is quite complex. Physiology is complex. You don't understand biology. But I will try to make it simple. If I want to have a product which gives structural support, a good product giving support on tissues where I need it, what is the kind of product for me? In my hands, it is intense. Why? Because it resists deformation in a way, it resists certain pressure that sometimes I need in certain areas, like the forehead. If on the forehead you have an eyebrow which is a bit lower, a bit depressed because of volume loss, and I want to actually have an impact on the eyebrow position, I need a product which I can place under the muscle but will not be deformed by the muscle, which can resist the pressure of the muscle. And for me that's a yes. Give back the volume and we'll be able to lift the eyebrow. Right? However, if I need soft volumization, I want to have this natural effect as if I did a lipofilling, especially on a mixed phase. Volume is perfect. It will give results as if it's super natural, like it's a fat mimic kind of problem. So it's actually a very beautiful way to soft contour. Having a very thin skin layer or very superficial. I always compare it to your forehead to an abdomen. If you do liposuction on an abdomen, the abdomen will not forgive. If you make any irregularity, you will always see it, especially in the sun. The forehead is the same. Make some more irregularity on the forehead that is superficial, it will not forgive. You won't have a product which is soft. It will not make irregularities. So if I'm superficial, for example, the forehead again, I don't need to lift the eyebrow because the position is already good. I just want to correct some volume deficiency. Then I can inject superficially. Inject superficially, I need a forbidden product. I will need something like balance. Right? Superficial injection, balance. The temples. If I would inject the temples deep, volume is amazing because it spreads nicely over the whole surface. Interfascial plane. For the moment, for some reason, I when you inject superficially, it will show irregularities in some patients if you inject a bigger product too superficial. Then balance is the amazing thing. Around the eyes, we only have a very thin layer of skin, no fat, musculature. We want the forgiving effect. Balance is the key. Maximum forgiveness. And with these three ways of using it, you can guide your way almost all indications. Actually, you can see all indications with these. This is an example of a young female patient. What do we see for her? What is the biggest problem, guys? Volume or laxity? She has both. I agree. But a little bit more volume issues than laxity. Because if you feel the skin and you cannot see it on the picture, she's got actually quite good skin tension. So even though she has laxity, we're going to focus for her on the volume. What will I do for her? Volume changes. I will treat forehead, temples, mid-face, jawline. I will not show you the videos, I have them as well, but I'm just going to do a live demo. I think it's nicer. So imagine that I have all these videos for you, and then I will show you now the end result. What did I do for her? All these treatments. And you see how impactful it is. Very natural. The forehead is liquid. There's irregularities, no irregularities. Intense place deep under the muscle. Massive in the eyebrow, no irregularity. Deep on the temple, volume, no irregularity. Soft, homogeneous volumization. The eyes look more open. This face, continuous soft contour. No lumps or bumps or irregularities. It looks like it's her own fat layer. Jawline nicely aligned. No strange, and that's also a good thing. Compare intense to volume. Volume is an amazing volumizer. It attracts a little bit more water than intense. Might give a bit more puffiness here and there. Here I treated the jawline, around the chin, no puffiness, nothing. Super straight. So intense is also a product which resembles, for example, radius the most. So for me, if I need an alternative to radius for some reason, I would always grab intense. Any questions so far? Yes. Definitely, definitely. So what you see is balance can be used sub-Q in areas around the eyes, forehead, temples when you're superficial. You can also inject it in the skin itself. You have these long lines on the skin, but you don't need to treat the whole neck because the neck quality is just good, but you have some folding lines. You can use balance there as well. And then you would use it intradermal injections, and it will give still smooth result. Sometimes you can also use it on the oral lines in the blanching way, and you spread the product in the whole dermis. It's beautiful results. And the funny thing is, if you look at the whole portfolio, the integration is so good. The CDM technology has such specific good integration, it's so forgiving, that I think you can inject intense in the dermis, which is the strongest, without having nodules. You have some people have super deep, strong lines around the mouth, depending on the skin type. And I needed to inject a strong feeling because the balance was a little bit too soft. The strongness is intense. I injected in the skin. Dermal integration is still so good that I don't get nodules. So that's only because of the integration capacity. Any other questions? Yeah. Tim, yes. Yes. The moment I go a little bit deeper, whether it's drug shots or professional, I will always go for volume. Why? Because what's the difference between the forehead and the rectum? The forehead has a very thin tissue layer. There are different layers, but they're very thin, so you're on the bone very quickly, you feel the bone very strongly. So the moment I have intense, I have the benefits of having a good lifting effect and resisting muscular pressure, but I can also massage it very well. So I can spread the product evenly throughout the forehead. The temples, you can still feel when you still massage, but it's a little bit more difficult to spread the case, and I don't need to lift anything because just when the volume is, not that I have a problem with pressure. So in that case, I prefer using volume to get this even distribution and beautiful volume relation because I don't need any push or anything. So whether I do gotcha technique, and especially with gotcha technique, because I use 1 or 2 points, but I have to fill the whole tempo, the whole fossa, and I need a product which can actually spread out to the area. I think it's more or less the same. I don't think there's a difference. I use it in the same way. Lips is really meant to be used as a combo, as a combination. So instead of having to open new box and full box of balance, you can use it to combine it in smaller volumes and still have the benefit of being able to use both shape as well as contour in a patient specifically comes for the lips alone. So for me, I just use them the same way, shape and intense, like I use contour and balance in the same way. And the benefit of these smaller boxes is that sometimes also I have an indication in which I don't need a full CC, not only the lips. I would also use contour, for example, on the teardrop. If I have a teardrop, I only need to do small volume correction. I would take a box of contour instead of opening a box of balance because I know for the teardrop, what will I use? 0.3 maximum. I don't need to go 1 cc. If I open a 1 cc, I will find something else to inject as well. But if it's just a teardrop, the contour will be enough. So that's the way I use it, and in practice, it works very well. Any other questions? That's a good question. Yes, Radius for the jawline is an amazing product, and depending on the patient, I will use it in its pure form, or I will sometimes apply it in a hybrid form, but it's really depending on the specific patient. But I will come back to Radius in the second part, and I will answer all your questions. Yes. Yes. Yeah, so then we dive into rheology cohesiveness. We see that the cohesiveness of the Bellator is super good. So if you look at the degrees of tests that have been done, some are a little bit more cohesive than others. It's a super good cohesiveness, and in general, I think it's difficult to compare because there's so many products on the market that what product will I compare it, of course. But for me, the biggest reason to use the range, the Bellator range, is the integration. That's for me, and that's of course correlated to the cohesiveness as well. But the integration capacity of the product is for me the biggest impactful characteristics if you look rheologically. So I would say balance, volume, probably intense. But on the level of integration, they also all show very good integration capacities. And you will see, of course, intense, I need it for its G prime. Right? That's something I really need for intense. Of course, a little bit of cohesivity as well, because I don't want the product to be smushed out. But I like intense for the G prime a lot. And you see that when you go to volume and then to balance, the cohesiveness becomes a bit more. I think so, yeah.
So, for the chemical in the substitute, you suggest putting better balance?
Yes.
So, not volume, not some like so, what about duration?
It will be shorter. It will definitely be shorter than volume. But I think the aesthetic outcome and the layers is be to volumize a subsmass. Right, that's what I want to do. I want to have the volume underneath the smass so that I can use a strong product. Yeah. That's a lot of people do 2 layers. The thing is, why do we sometimes use 2 layers? Because it's difficult to get a full effect on the whole surface area, and sometimes, especially if you go from the zygomatic bone upwards, it's sometimes difficult to maneuver and stay in the same layer throughout the whole treatment. So then it's more comfortable to do the double layer approach. Now, the moment that you use, and I will show and demonstrate this, the temporal crest entry point with the cannula, it's easier to maintain, easier to be between massa and muscle, and if you use then the right product like volume, you will still have a full smooth effect. So when will I then go to balance superficially? Maybe in some patients which have, for example, very thin tissue or very thin skin, or there's a big vessel in the way, I cannot go from above, then I need to go from below. Then I will maybe say, okay, you know what? I'll make it easy. I'll go just a superficial and use it.
So what do you use the imperfection?
Preferably, I like the imperfection.
For the intensity forehead, do you think it will be good configuration happening because you know a little bit strong?
Yes, and that's why I think enhance is the best. It will still give volumization, lifting, integration, and of course the forehead is a tricky area. It's difficult to treat the forehead, but I think the moment that you have a right entry point, and yeah, technically it looks more difficult than it is. So I'm sure that if you practice one time together, or you show it to you the next day, you can do it. The tricky thing is that sometimes there are some attachments of the fiber substrate network to the bone, and then when you start treating, the patient might be a little bit uncomfortable. And the trick is then to just find your way of the least resistance and not push through the resistances. Because then the patient will be uncomfortable and maybe the treatment will be uncomfortable. But the moment that you can find a way around the resistances, it's less painful for the patient. And because you have a good bony structure, you can still have an even result because you can massage it all the way. So you don't have to put the product everywhere exactly the same. You can just go around it, put it at some hot spots here and there, give a bit extra. You will make irregularities, but then you massage it away. Shall we go to the next? She's here already. Perfect. Well, have a seat. Where are the pens? So, maybe you can go a little bit more to the back, a little bit angle like this. Perfect. So, facial assessment. Facial assessment is always a tricky thing. Who has issues or difficulty sometimes making a good facial assessment? Because for me, facial assessment was in the beginning when I started in the industry the most difficult thing. Technique, you can learn. Product choice, you can learn. Facial assessment, there's no book on facial assessment. There's no article on facial assessment. There's videos sometimes, but it's difficult. And patients are different. The issues patients have are different. So facial assessment is crucial to what we do, but it's still very good. We have these different tissue layers, so we want to add more in the center. Because I think this will this be better for you? Yeah, maybe so. No, the injection, yes. The injection, yes. Maybe you can sit.